Greetings. This is Mushtaq Memon, Professor Emeritus from Washington State University. This is our second video on horses. The first video was on importance of horses in our society. Now we are going to focus more on reproduction or theogenology of equine. So the first video of that is Comprehensive Guide to Mare Reproduction, Infertility, Evaluation, and Breeding Soundness Examination. This 6-year-old maiden mare was presented to me some years ago with the complaint that she is not getting pregnant. She was bred multiple times, but no pregnancy was diagnosed. So the question comes in that when you are presented this kind of case, where do you start? Well, to understand a complete story of reproduction in the mare, which is very unique, I think we need to have a grasp on some basic concept of mare reproduction. So the first thing is that we need to appreciate that this animal is what we call seasonally polyestrous. Means that she cycles, she comes in season at particular time of the year when we have long days and short nights, maybe close to about 16 hours of light and 8 hours of darkness. So what that does is that the mare gets this light through her eyes, goes through optic nerve, and processed through hypothalamus, and then it stimulates the pituitary gland and hypothalamus to release hormones which are necessary to make this animal come in estrous and start, ready to be bred. So here in the United States and many other parts of the world with similar climate and seasonality, our mares cycle sometime in the spring and summer of our time here in the U.S. Whereas, some other countries, which are especially those which are close to the equator, I have seen cyclicity in different ways in developing countries, especially. So without going into too many details, let's just stop at their seasonality, that we appreciate that mare can come in, long days and short nights. That could be controlled, by the way, with photo period control with artificial lighting, but I wouldn't go that in this video, but I just wanted to make you appreciate the uniqueness of the cyclicity. Now, once we understand that, and then equally uniqueness is about the reproductive anatomy of the mare. As you can see here in the picture of this reproductive anatomy, we have the uterus, which has got two horns, just like any other animal. It's got two ovaries, and then it connects with the cervix, vagina, and things like that. Now, if we look at that reproductive tract, this is from a mare, which is the reproductive tract is hanging on the pelvic inlet, and from the other side, the operator is going to come in and try to show us how to palpate this reproductive tract. Now, before we go to that, I just like to make an important point here. You look at the placement of these two ovaries. Just like you're looking at the clock and you see one ovary, the right ovary from my right, is on at about 2 o'clock, whereas the left ovary is about 10 o'clock. So these ovaries are fixed, so is the reproductive tract. So it's not as movable and flexible as some of us may be familiar with cow reproductive tract. So because of the fixation of this reproductive tract, we really do not try to retract, reproductive tract as we would do in bovine. The reason I mention about bovine or a cow, because many of our large animal practitioners or the students interested in these areas learn first from cows, especially in our developing countries. So I just wanted to make sure that these are two different animals with different type of anatomy of the reproduction. Now, Here I've got two pictures again. On the left side is a picture of a real specimen of the reproductive tract. Here the important point to consider are making sure, look at the shape of this uterus. This is almost what you call a T shape, T like in tango, which is very different from cow reproductive tract, which is what we would call V, like Victor, V shape in cow, T-shaped uterus in the mare. And on the right-hand side, it gives you the side view of the reproductive anatomy, showing the rectum, and on the top, where you will stick your hand in and try to get hold of the reproductive tract when you do a transrectal palpation. So here we are. So extreme left, you see the picture is the operator trying to palpate the reproductive tract, but I like to make some important points here. Number one is that we have to consider safety of the operator as well as the animal. Now, what I'm talking about? Well, as you know, the mare and the horse are fairly powerful animals. They can quickly hurt themselves as well as to us. So before we examine, we have to make sure that we have a proper restraint place. Like here, you see, these are what we call horse stocks or mare stocks that mare has brought it in. And then once she's inside, then there is a little gate you see, which is showing in. Now the gate has a nice pad behind it. So it's a padded, that little, gate. So it is enclosed, and then the operator goes with the sleeve and, the lubrication and things like that, goes inside, empty out the rectum with the fecal material. Fecal balls more like a balls, small, very well formed fecal material, which is very, very different again from the cow, which is more fluidy type. So here you have to take those fecal material out, clean it out as much as you can, and then have a plenty of lubrication, and you go in and try to feel the reproductive tract. So number one picture shows you with the gloved hand. You see white gloved hand coming from the back. This operator and will try to pick up that almost like a cup shape, in the uterus in his or her hand, and then go sweep through and goes all the way to the left side or the right side. And as you can see on the second picture, this is exactly what the operator is doing, is to trying to go on, on the right side first, and then will come on the left side. Now, there are some folks that they feel more comfortable to go to find ovary first, because ovaries are also fixed. So either way, whatever is comfortable for you, making sure that we are sweeping the whole reproductive tract without missing anything. Because we will talk in some other videos next time to how to diagnose pregnancy, where pregnancy will be very located in one small area. So we will not to miss it. So we want to make sure that you sweep the whole thing. Now, when I say you sweep whole thing, you will feel it. I have to be honest with you that those of you who are starting new in this area, just like going on cow or horse is the same thing. When you put your hand in, you feel like you are in some kind of dark hole, which is really what it is. It's you can't see anything. So your hand is in the rectum, but trust me, more you do, more you start, so to speak, seeing things. With your fingertips, you get to the point where you are not only able to feel things, but you could even measure the size of those structures with their ovaries and follicles, things like that. So more you do, more you learn. So this is all is the clinical practice when we talk about it. So when we talk about the ovary, and this is a very nice picture, make us appreciate the shape of the ovary, which is a bean shaped. You see, bean shaped, kidney shaped, whichever you want to call it. And you can see the small arrows on the top. It is showing that there are multiple follicles on that ovary. And then the left-hand side of the corner shows you a picture, and that is ultrasonographical picture of the same ovary, showing this black area, which are what we call anechoic image of the follicle. So this ovary has multiple follicles. But there is most of the time only one follicle ovulates from the ovary, and that ovulation takes place from that curved area, or you call ovulation fossa, regardless where the follicle comes from, how big it is. So it kind of moves around and comes close to that ovulation fossa before it ovulates the mare. So again, the size of the ovary varies quite a bit. More follicles you have, the peak seasonal time you are, bigger ovaries will be. Other unique things about the mare ovary is that it has a different histological setup. Like here, we have the cortex in the middle, and medulla is on the other side, outside, which is reverse again from the cow. So let's keep on moving about, we are palpating this cow per rectum, or some people call it rectal palpation. So as we move in and we feel the cervix, which really relaxes during the mare when she's in estrus, obviously under the influence of estrogens. Sometimes the cervix is so relaxed that it just flattens out on the pelvic floor. So it's hard to even outline, but with your practice, slowly, you will find the cervix is there. And then the same cervix, when it comes to the diestrus, is formed, kind of firms up. And in anestrus, really, there's nothing very unique about the cervix that you can feel. Still, we are palpating the cow per rectum. So here I am trying to compare now with mare and the cow. As you can see, let's just start with the left side here. So we have the uterus. So in the mare, the uterus feels having some edema. There's a spongy feeling when you're doing it through rectal palpation, whereas the cow, the uterus is very firm and tubular, almost like feeling a water hose. So that's the cow. So the mare, which I already mentioned, is a kidney-shaped ovary and has its own ovarian follicle. So if I bring these two ovaries, you can see, again, the kidney shape in the ovary, whereas not the cow. Cow is a more kind of almond-shaped ovary, as you can see there in this. So here is again my individual mare ovary, and your grayish area you see on the right-hand corner down there, that's a whole follicle. So whereas you see in my two fingers there's a cow ovary, it has a very shiny little bubble on top of it, and that's a blister-looking structure, is the follicle on cow's ovary. Whereas after ovulation in the cow, then we have a corpus luteum, and you can see the picture we just showed up. It has that nice meaty feeling with the line of demarcation is the cow corpus luteum. Now, because as I mentioned to you, the histology of the ovary of the mare, that corpus luteum does not protrude from the ovary when you feel through rectal palpation. So corpus luteum is really inside, of this ovary, which you can see very easily on ultrasound, but not on rectal palpation. So I think this is another unique thing that we need to appreciate when we talk about the mare. So I did briefly mention about the ultrasound. Ultrasonography is very commonly used, not only for breeding management, but also for diagnosis of infertility, diagnosis of pregnancy, things like that. And this picture, you could see operator is doing transabdominal ultrasonography, trying to find the late pregnancy here. So without going into too many details about the pregnancy right now, I'd just like to mention, looking at this ultrasound machine, that there are some basic concepts of the ultrasonography which we need to appreciate. Number one, we talk the language of ultrasonographers, what we call echo. We are looking at the echo, the sounds which are going from your probe to the tissue, and then the sounds are coming back. If they're not coming back, it means you're putting sound in. It's a fluid-filled structure. All the sounds are absorbed, so that will be our anechoic image. There's no echo, no sound is coming back. Then you have got sometimes soft tissue. You are trying to visualize sometimes uterus, things like that, will have a gray kind of appearance, will be hypo, Hypo, hypoechoic image. But if you take the probe and put on the bone, not many sounds are going through the bone, so that would be very, white. All the sounds are coming back would be called hyperechoic image. There are three commonly used probe in equine practice. It's 3.5, 5, and 10 megahertz. So those are the three were commonly used. Now, so doing again transabdominal ultrasonography. Here we have a senior student at Washington State University with the help of a resident as a Mare in stocks, as we talked about before, and she is trying to feel with her hand, at the same time visualize on the screen of ultrasound machine to see what she's seeing. So she has a big follicle on the ovary, which right in the middle picture you see the conical shape. And most of the follicles in the mare, before they ovulate, they form that conical shape. Before they come out, the follicle comes out, and that's the ovary on the right side. So again, just to look at very closely, so this right cylinder, the black color cylinder type thing in our operator's hand is the probe of the ultrasound. So as you can see in the left-hand side picture, this operator is bringing that probe and try to scan it, just like sweeping it, through the uterus. And once you get used to this thing, you will see it's very, very rewarding to see all these structures. And this is a kind of a fairly busy picture, but I just like to share with you is from Dr. Rob Lofstead, professor at Prince Edward Island High School in Veterinary School in Canada. He has a very famous good site called Lori, Lori, which I mentioned there. These pictures are from that place. As you can see here, he is showing on the left side on the top how you're going to take probe and everything. Let's walk with me, okay? So here we have got that little compartment on the top on the right-hand side is called A. So letter A, you have got the follicle on the right side. On the left side, you see that spoke wheel kind of, shape, and that's edema of the uterus. Very, very nice shape that we see almost in all the mares we are in heat. So that's A. So when you come to the B, you could see the uterus with the edema, and it's got also some fluid in the middle, which is anechoic, the black area. When we come to the C, and that's the same thing I was talking about, the follicle, you see how conical it becomes. And then on the D, you see the corpus luteum, which is kind of a little more, hypoechoic image. And then when you come on the extreme right side, there's E, is the hematoma. Now what that means is that when it's a follicle ovulates, we have quite a bit bleeding there. And in many mares, that forms a nice accumulated blood area in shape of a hematoma. And that's a fairly normal finding in the mare. So this is really what I wanted to share with you today. But I really look forward to sharing with you more information about equine reproduction, because it's such a fascinating animal. And it has got still a lot of things to learn about. But in the meantime, if you've got any questions or comments, please feel free to jot it down and put it on my YouTube channel, and I will try to answer those as much as I can. In the meantime, I wish you well. Bye-bye.